Every year, across England and Wales, around 1,000 people aged 65 and over are admitted to a specialist burn service for treatment of a burn injury. Many more people are treated at emergency departments and minor injury units. The majority of these burn injuries are accidental and occur in the person's own home, often in the kitchen during food or drink preparation. The most common injuries are scalds caused by hot fluid spills from kettles, saucepans, hot drinks, or hot food. Burn injuries caused by flames or contact with a hot surface, such as an electrical oven or hob, are also common. Older people stay in hospital longer, on average around 13 days, and are likely to require more follow-up appointments for dressing changes and scar management. However, by taking a few reasonable precautions, the risk of sustaining a burn injury in the kitchen can be avoided. Here are some tips from our burns expert. Ensure your cooking space is clear of all flammable items such as tea towels and kitchen roll. Use the back burners on the hob whenever possible and never leave handles sticking out over the front of the hob. Don't leave food cooking unattended. Set a timer to remind yourself to turn off the oven, grill, or hob. Always wear oven gloves when removing hot dishes and pots from the oven, and ensure you have a clear space on your worktop or table to put these down. If frying food, use a lid to prevent hot oil spitting onto your skin. Wear short or tight-fitting sleeves when cooking. Tie long hair back and ensure headscarves are not hanging loose. Only fill the kettle with as much water as you need for the number of drinks required. A full kettle can be very heavy and easily dropped. Even if we do everything possible to reduce the risk of injury, sometimes accidents still happen. Knowing the correct first aid and applying it quickly within 3 hours of a burn can reduce the seriousness of the injury. Here are 3 simple first aid steps to remember. Cool, call, and cover. These actions will reduce pain, swelling, and the risk of complications which cause scarring. Cool. Firstly, remove any clothing and jewellery from the burn area unless it is stuck. Cool the burn under running water from a tap or shower for at least 20 minutes. As well as providing pain relief and cleaning the wound, this minimises swelling and stops the burn from damaging the deeper layers of skin. If it's not possible to cool the burn under running water, reapplying clean cloths soaked in cool water frequently for at least 20 minutes is also effective. Only cool the burn area, not any other parts of the body, and ensure the injured person is kept warm. Call. Call NHS 111 for advice on any burn larger than a 50p piece or if there are any blisters. NHS 111 will give further first aid advice and may suggest that you go to your nearest minor injury unit or hospital. For more serious burns, call 999 for emergency care. Cover. After the burn has been cooled for at least 20 minutes, cover the wound with loosely placed cling film or a sterile, non-fluffy dressing to ensure that it remains clean. This will also help to reduce the pain. Don't apply any creams or other products to the wound without medical advice. If the wound is not healed within 2 weeks or there are signs of infection, seek further advice from your GP, NHS 111 or minor injury unit. The wound may be infected if it is increasingly painful, smelly, there are signs of increasing redness and swelling of the skin around the wound, or if you feel unwell with a high temperature above 38 degrees Celsius. Unfortunately, despite our best efforts, accidents can happen. But if you are prepared and remember to cool, call, and cover, you can reduce the impact of a burn injury and ensure better recovery and outcome. Please share this message with your family and friends. Burns can happen to anyone, whatever their age, and cool, call, cover is the best first aid that can be given for the majority of burns.